Have you ever noticed spots, patches, or lesions on your tongue and wondered what they mean? It is easy to overlook these changes, but your tongue can be a powerful health indicator. While some spots are harmless, others might signal underlying health issues that need attention. Today we are breaking down the most common types of spots and lesions you might see on your tongue and what they could mean for your overall health. Let us decode what your tongue is trying to tell you. Let us start with white patches, one of the most common changes people notice on their tongue. These patches can stem from a variety of causes, so understanding the underlying reason is the key. One possible cause is oral thrush, a fungal infection caused by an overgrowth of Candida albicans. Oral thrush presents as creamy, white, slimy, raised patches that can be scraped off, often leaving a red or raw surface underneath. It is more common in people with weakened immune systems, such as those with diabetes, individuals undergoing chemotherapy, or those taking antibiotics. Another potential cause is leukoplakia, which results in thick white patches that cannot be easily scraped off. This condition is often linked to smoking, chewing tobacco, or excessive alcohol use. While leukoplakia is usually benign, it is important to monitor it as it can occasionally develop into oral cancer. Lastly, lichen planus, an autoimmune disorder, can also cause white patches. These often appear as lace-like white raised pattern on the tongue or inside the cheeks. While lichen planus is typically harmless, it can sometimes cause irritation or discomfort. Here is the quick tip. Persistent white patches should never be ignored. If you notice them lasting more than 2 weeks or accompanied by other symptoms, it is time to consult a healthcare professional. Now let us talk about red spots on the tongue. These can often result from minor irritations like accidentally biting your tongue or eating spicy or acidic foods. However, persistent or unusual red spots may indicate something more serious. For instance, red spots accompanied by pain or swelling could be a sign of glossitis, an inflammation of the tongue. This condition can be caused by infections, allergies, or nutritional deficiencies, particularly a lack of vitamin B12 or iron. In rare cases, persistent red patches, especially those that are raised or accompanied by lumps, might signal oral cancer. Early detection is critical, so if you notice any red spots that don't heal after a week or 2, it is best to see a doctor or dentist for further evaluation. Now here is the scientific insight. Glossitis results from irritation or infection that cause the tongue to swell and its surface to smooth out. This is why areas affected by glossitis often appear red and tender. Have you ever had one of those small painful ulcers on your tongue, gums, or inner cheeks? These are known as canker sores, and while they are harmless, they can be incredibly uncomfortable. Canker sores are typically triggered by factors like stress, minor injuries like accidentally biting your tongue, or certain foods such as citrus fruits or spicy dishes. The good news is that canker sores are not contagious and usually heal on their own within 1 to 2 weeks. However, if they are particularly painful, over-the-counter treatment like mouth rinses or numbing gels can provide relief. Now here is the pro tip. If you experience frequent or unusually large canker sores, it might be worth consulting a healthcare provider to explore potential underlying cause. Addressing these triggers can help reduce their occurrence. Let us wrap with a condition that may look alarming but is completely harmless: geographic tongue. This condition gets its name from the map-like pattern of irregular red smooth patches that appear on the tongue's surface. Geographic tongue occur when certain areas of the tongue lose the tiny hair-like projections called papillae, creating smooth, shiny patches. These patches can change location over time, which might make it seem like the pattern is moving. The exact cause of geographic tongue isn't known, but it is often associated with factors like stress, allergies, or hormonal fluctuations. While it is generally painless, some people might experience mild sensitivity to spicy, salty, or acidic foods. Now, here is good news: no treatment is needed for geographic tongue, and it doesn't pose any health risk. If the patches bother you, try avoiding foods that seem to trigger sensitivity. Spots or lesions on your tongue can range from harmless conditions like geographic tongue to more serious issues like leukoplakia or red spots that may need further investigation. Here is what to do if you notice changes. Number 1 is monitor duration. If the spots or lesions persist for more than 2 weeks, it is time to see a healthcare provider. Number 2 is pay attention to symptoms. Look for accompanying signs like pain, swelling, or difficulty eating and speaking. Number 3 is practice good oral hygiene. Keep your tongue clean with gentle brushing or a tongue scraper. Number 4 is avoid irritants. Cut back on smoking, alcohol, and spicy foods that can worsen tongue issues. Remember, early detection is key for addressing serious conditions. Your tongue is a vital health indicator, and paying attention to its signs can help you catch potential problems early. Your tongue is more than just a tool for tasting. It is a reflection of your overall health. From white patches caused by oral thrush to harmless but curious patterns of geographic tongue, these signs are your body's way of communicating. While staying vigilant and seeking medical advice when needed, you can address potential issues early and stay on top of your health. If you found this video helpful, please like, share, and subscribe to our channel for more health insights into what your body is trying to tell you. And here is a question: have you ever noticed unusual spots or lesions on your tongue? What did you do about it? Share your experiences in the comments below. Stay tuned for our next video. Until then, take care of your health and keep an eye on the subtle signal your body is sending. Thank you very much for watching.